This podcast focuses on issues related to the prostate, with an emphasis on providing practical solutions that people can implement at home to improve their well-being. It mentions that it will not delve deeply into physiology, but will discuss the main conditions. Benign prostatic hyperplasia BPH and prostatitis, especially non-bacterial prostatitis. Benign prostatic hyperplasia refers to the enlargement of the prostate, a common condition in men over the age of 35.
Welcome. I'd like to talk about prostate issues. There's two separate entities, and I'm not going to go in.
Although not all men with BPH exhibit symptoms, those who do may experience urinary problems due to the compression of the urethra. Risk factors include family history, type 2 diabetes, lack of physical exercise, and erectile dysfunction.
To the deep physiology, I want to go into the nuts and bolts on practical things that you can do right now at home to help yourself feel better.
Additionally, the influence of dihydrotestosterone DHT, a hormone derived from testosterone, is discussed. DHT can cause both prostate growth and baldness. On the other hand, non-bacterial prostatitis is an inflammation of the prostate that does not respond well to antibiotics.
Scientifically, we can do that in another video. We have benign prostatic hypertrophy or hyperplasia. That's based.
Although it is often treated with them due to a lack of understanding of its exact origin. Common symptoms include testicular pain, rectal pain, difficulty urinating, and frequent urination. The podcast host mentions his personal experience with prostatitis since his 20s.
Meaning that the prostate's getting bigger. I'm going to touch on that in just a second. And the other aspect that most people are having, particularly men, obviously, over the
highlighting the ineffectiveness of conventional antibiotic treatments. He suggests that it is crucial to address the underlying causes of these problems and proposes dietary changes and the incorporation of specific herbs and vitamins as possible solutions to improve quality of life.
The age of, I would even say in the 30s today, is prostatitis. More non-bacterial prostatitis. Very few people have
reduce pain and enhance mood and personal relationships. Additionally, it is mentioned that hyperinsulinemia, elevated insulin levels in the blood, and insulin resistance may be related to prostatic hyperplasia and essential hypertension.
Have acute bacterial prostatitis. That is obviously something you need to treat immediately with antibiotics. You're going to have fever. You're going to have lots of pain, burning.
Recent studies indicate that high glucose levels in the system, leading to excessive insulin production, can promote the multiplication and growth of prostate cells.
But in general, the average male who just gets testicular aching in the rectal area, and obviously affecting your stream when you urinate, frequent urination, because of the fact that the urethra goes through that little walnut-sized prostate. And when that prostate's inflamed,